Hi, I'm your host, Marsha Florence, for Just Ask Talk Show. Today's show, ladies and gentlemen, is Ask Me About Medicare. Hurry back and join us. Hi, I'm your host, Marsha Florence, with Just Ask. Today's show, ladies and gentlemen, is Ask Me About Medicare. And we have with us Certified Senior Advisor, Rodney Ross. Good afternoon, Rodney Ross.
Hey, Marsha. How you doing today?
I'm good, good. And thank you, Rodney, for coming back to join us.
I'm absolutely thrilled to be back. I thank you for your kindness.
Well,
thank you.
You know what, Rodney, is now you came before, you and John.
Yep.
So a lot of people are somewhat familiar with you, but we want to ask you to refresh your visit with us from the first time to talk about Medicare, because a lot of people are still confused. And the first show was Understanding the Medicare Maze. Now we're here with Let's Ask Rodney a few questions about Medicare. So let's talk about yourself first.
Okay, cool. Appreciate that. So our organization, we are actually advocates. We advocate for persons that are Medicare beneficiaries. Yeah, our title, Medicare broker, all that means is that we work independently. We write business for 11 different companies here in Michigan. However, we work for our clients. We do not work for the insurance companies, and we provide advocacy services. So talking to us, we're able to tell a beneficiary what their Medicare plan encompasses, the benefits that are included, and we help them understand how to navigate and access those benefits. That's the advocacy part of the work that we do.
Okay, so I know you told us before there's a difference between an agent and an advocate.
Absolutely, absolutely.
Okay.
As an advocate, we sit, we counsel, we work with, and we ensure that our clients fully understand what they've got, how to use it, and how to access it. And they see us and hear from us all year long. An agent, they come, they sign you up, and then they do the ghost thing. They're gone, you can't find them. As an advocate, my phone rings. People have a question and they call us. They don't have to call the 800 number. They don't go through 24 prompts, to try to get to a person. They call us. They go to the refrigerator and they find the magnet that says Rodney Ross on it, and they call my phone number.
Okay. Okay, so now we got to this point where now we're in another phase of the insurance enrollment period. What do we call this?
Well, so we're now coming to the tail end of that period of time in which, unfortunately, so many Medicare beneficiaries are probably burned out right now. The phone calls and everything that goes along with it. We're about to enter a phase in which the beneficiary is actually able to be in control. Every year, starting January 1st through March 31st, the government calls that the Medicare open enrollment period. And during that period, agents and companies cannot just randomly blow up your telephone.
Okay.
You have control. And if you have a concern or a thought or question, you want to talk to an agent, the agent has to wait for you to initiate the contact with them. So this period of time, now there's one drawback, which is you can only make one decision and one change during the January to March period. However, you're in control. The government does not let all these companies just intrude into your life and into your world, blowing your phone up all day long. Okay,
so let's back up here because I know my phone rings. So, okay, so every year, like clockwork, from we say October to December.
Yes.
That's open enrollment.
So that's annual enrollment.
Annual, okay,
correct.
That's annual. So
and
that's every
when
year.
Everybody that has Medicare has the opportunity to do something. Change, keep it, or nothing.
Okay.
And that is a time in which everybody's getting blown up and getting harassed. I'll use that word. And it's a marketing frenzy for the insurance agencies, the insurance business. The January to March, the government has tightened that down, and that is a period during which if you are enrolled in the Medicare Advantage plan, which means you have a plan that a private insurance company wrote you up on. That plan is called Medicare Advantage, and there's a special enrollment period for people on those plans, and that starts January 1st, runs through March 31st, and that's what's called the Medicare Advantage open enrollment period.
So let me ask you this, because I know somebody's at home watching going, now wait a minute, now I signed up in October through December and I got what I thought I wanted. Now you're saying because it's January to March I can make a change, but you said one time. So is that one policy program, or is that, let's say like I got hearing, vision, and dental. Am I allowed to change all three of them if I want, or put one in, take one out? What do I do?
Short answer is no.
Okay.
The Medicare Advantage plans, those are the plans that include comprehensively hospital, doctor, prescription drugs, dental, hearing, vision as a single package.
Okay.
So, no, you don't change them individually. However, during the October-December period, you literally can change into your different plan every other day. And wherever you are December the 7th at midnight, that is what you have going into January. If you have a Medicare Advantage plan in January and you have buyer's remorse or you change your mind, you have one opportunity to make a change. And that's the difference.
Okay.
You can make one change between January and March 31st.
Okay, so sounds pretty good. So I tell you what, we're going to take a break and we're going to come back with some more good information about Ask Me About Medicare. We'll be right back.
If you love them enough to do this, surely you'll check NHTSA.gov/the right seat to make sure they're correctly buckled in the back seat.
When I was growing up, my mom was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere. And just growing up the way I grew up, and to see this transition was very alarming.
When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
And welcome back to the show. Now, ladies and gentlemen, if you're just not tuning in, get your pen and paper out. You got questions. Get the number at the bottom of the screen, 1-800-323-5336. And you can give us a call here at Just Dance Talk Show. If you'd like to reach out to talk to Rodney Ross, well, send us an email or drop us a line some way, somehow. You'll see our information at the bottom of the screen or in the credit roll, and we will get your questions over to him and any other guests that you have interest in. Now, today, if you are paying attention to this, ladies and gentlemen, and you know that you were bombarded by all these agents and people talking about what you want to do for your insurance and this, that, well, Rodney Ross has come today to give us a little breakdown of how you can, the first of the year, January through March, always know that you got the opportunity to make a change, and the change is on your grounds, not the agents, not the advocates. It's what you feel like you want to do, and you can talk to a person one-on-one and say, hey, I thought I picked the right policy for myself, but I didn't, so I want to make a change. And like he said clearly, one-time change. All right. So did I say that right, Rodney? Because I know you're here to tell us, and I just want to make sure that the viewers get a very clear understanding.
You said that very well. I would add this caveat to it. For the person that between October and December, they were just done with it and they decided to do nothing at all, that's fine, because all is not lost. We're now entering a period of time in which they can safely make a decision about what to do and if they want to change anything, and they can do it in their own terms. Okay. Because companies, agents, brokers, we are not allowed to enter into solicitation of Medicare beneficiaries starting January 1st. So once we get into the January 1st Medicare Advantage open enrollment period for all Medicare beneficiaries, who have a Medicare Advantage plan, they are in the driver's seat. Okay. And they are able to reach out to any organization or our organization, and we can guide them through with their request, finding a plan that works great for them. But what should happen, the first thing they should notice in January is that ring-a-ling-a-ling on their telephone should
stop.
Yes.
Has stopped. Right, right.
And I highly encourage them, if they get solicitations, they really should report whoever is calling them, because we are not supposed to be soliciting Medicare beneficiaries during that time.
I mean, every commercial, you know, that came out within that certain time frame is all about health insurance, health and wellness, and we got it. So we know that there are 65 million people on Medicare. Okay, so at this point, what are we saying with that number that way?
So that's correct. There are 65 million people that are on Medicare. Half of them are still on original Medicare, which means they're getting their Medicare and their health plan through the government, only Part A and Part B. And if they get prescription drugs, they're paying for it out their pocket. If they get dental, hearing, vision, they're paying for that out of their pocket. So they are missing the opportunity to have a comprehensive health plan, which are what Medicare Advantage plans represent. You get your hospital, your doctor, which is what the government provides, but their private insurance plans, they include prescription drugs, dental, hearing, vision, and the other ancillary things you hear about in the commercials on television.
Okay. You cleared that up, because a lot of people, they just feel like I'm not doing anything and hey, it's working what I have, but when they need something, such as prescriptions or whatever, and they don't have the coverage, they didn't think about what these periods mean from the fall part, the winter part, which is October to December, and then here we got this opportunity come the first of the year, and we still didn't do anything. We still sat back until we are actually in need of some type of coverage, and then it's discovery, and that's what makes it hard for people to understand how to utilize their medical benefits. We always think in terms of, if that's for the hospital, okay, that's if I go to the hospital. But a lot of people don't understand the clarity of when you can use your dental, when you can use your vision, and when you can use your hearing.
So when you say that, Marcia, that makes me want to go back to the distinction between working with an advocate versus an agent, because our focus, our organization, our team, our focus is on the understanding component, being sure that our clients understand their benefit, how to utilize it, how to get the most out of it. Matter of fact, here's what we tell our beneficiaries and our clients. It's really important to use your benefits. Here's why. Insurance companies measure how many people use the benefit. And for those benefits that have what they call a low utilization, which means folks ain't using it, those are the first benefits that are cut back on. So it's very important. And many people that don't use their benefits, it's not because they don't want to, they just don't really understand how to navigate them. And all the companies have no customer service numbers, but here's the number one thing I hear from my clients. When you try to call one of these companies, you got to answer all these prompts. Do you want this? Do you want it? No, what department do you want to go to? No, put in all this information. And that fatigues people. And, we just have people who want to get help. They need help, but it needs to be help that is easy, it's accessible, it's clear, and human-based help is much better than this AI world we're living in.
Well, it's coming. So answer this, what's the ongoing Medicare disenrollment due to redetermination? What is that all about?
Well, the pandemic. We're tired of hearing that word perhaps. However, there were things that were incorporated that protected people during that time period starting in 2020. Now changes have come, and the pandemic emergency has come to an end, and the programs that were being funded with no questions asked, they're also coming to an end. Medicaid is one of those programs. Medicaid has always required beneficiaries every year to recertify, to prove that their income is still at a low level and they qualify. 2020 to 2023, that was not required. They did not do it. They, being the government, did not do it. Well, starting in April 2023, they began requiring the beneficiaries of Medicaid to once again fill out the forms and the applications and the paperwork to prove that their income and their assets met the Medicaid requirements. Okay. Many people missed the letters.
Right.
I think many people probably didn't get the doggone letter.
That was the letter, it was on the news, you know, I mean, but people were like, you know what, if it's not in my face, or if nobody come to me directly and tap me on the shoulder, it must be all right until I needed to use my benefits. So they did miss that.
So even more to the point, I mean, why do you call it something redetermination? I mean, like, seriously?
Right.
Everyone's supposed to hear that word and know what you're talking about, government?
Right. It was no clarity on it. But during the pandemic, because a lot of the benefits were offered to individuals, whether it was medical, food stamps, utility, housing, all that was encompassed. So people were happy to know that they didn't have to go to work because the government was taking care of everything pretty much. And then they didn't think it was a stopping point.
Right.
And when the stopping point hit home, the scramble, I mean, the breakdown, you know, I mean, we've done shows on what that meant when people were supposed to be, you know, dealing with the redetermination. And it was like, I got the messages the last minute. I know. So now we know. Now we really know.
So, you know what? Once again, Rodney's going to talk about difference between an advocate and an agent, because our clients, I have read the applications. I've read the letters because our clients, we warned them to be on the lookout for it. So they were now looking for mail that was coming from the state of Michigan. They were looking for it. So we were getting phone calls saying, hey, I got this letter, Rodney. Can you come, you know, take a look at it? Now, if it was Marcia calling me, I might probably say, hey, Marcia, take a picture of that letter and text it to me.
Wow.
However, I work with a good number of clients. They have flip phones. They don't, you know, they don't take pictures and send text pictures. So therefore, we were going to our clients' homes and sitting with them and reading these letters. For clients, beneficiaries, they had an agent that they couldn't reach, didn't know how to find them. They were on their own.
Yeah.
So, you know,
a lot of people dropped through the cracks a little bit. So
a lot of people.
I'll tell you what, we're going to take another break. And ladies and gentlemen, I know you got questions. So I'm going to ask Rodney Ross. We'll be right back.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
Maybe you don't like watching workout videos, but this is more than that. Thanks to the Leukemia and Lymphoma Society, I'm doing this as a blood cancer survivor. So really, this video is actually about how vital your donation is in helping thousands of patients like me thrive. Please consider donating to the LLS, because every dollar raised today helps more people thrive tomorrow.
And welcome back to the show. Now, ladies and gentlemen, you know I always say get your pen and paper out. I tell you that 2 or 3 times during the show. Why? Because everybody always has questions, so you can most definitely give us a call, 1-800-323-5336. Email me at Marcia@JustAsTalkShow. And now it's not Twitter, it's X, whatever, so we still have all those things available to you. If you missed the show on one of our networks, PBS, Comcast Detroit, Comcast Southfield, Birmingham, Bloomfield, Lake Orange, Troy District, any of these areas, if you miss us, you know you can see us on YouTube, okay? YouTube and Facebook, Podcast Live. So don't think that, hey, I missed that program. You can always reach out to us, and we have so many ways. And if I left one of our communities out, sorry, I'll do it next time. All right, so I wanted to ask Rodney about some questions in reference to being 65 means a whole lot these days, okay? It's not just a birthday. So, you know, I mean, you know, people are like, I'm 65, I should have this, I should have that. So, being your Medicare enrollment process between 120 days and 90 days before your 65th birthday. Why?
Well, what Medicare through Social Security Administration will tell you is that 3 months before you turn 65, begin the process of enrolling in Medicare Part A and Part B. Before we got into the pandemic and we had people not coming to the office and you had to make appointments for Social Security, prior to that, 90 days was pretty reasonable because you can go in, sit with someone at the window, get help, and they will get you enrolled, generally in a matter of weeks, maybe a month. However, with the shortages of the employees working and with the difficulty getting into Social Security offices, I always encourage people to start 4 months in advance versus 3 months in advance.
Yeah.
There's no downside to it. It just helps to ensure that by the day you turn 65, your Medicare is already active. You've got your Medicare card. You've given the Social Security Administration enough time to process all your paperwork and get your information to you.
So you suggest or recommend 4 months in advance?
I do.
That's pretty good.
I do.
mean, that's pretty good. And I know you guys do a lot of community engagement. So, I want to ask you about that. Do you go out to social gatherings, or how do people actually connect?
So that's part of our DNA, connecting with the community and organizations. And we really, really, really focus on, I don't want to say mom and pop groups, but we focus on just regular communities, and we talk to people and we try to get invited to just regular small groups and sit down and answer questions. We try very hard not to go and do these long Medicare presentations with 84 slides that Medicare wants me to go through, and it takes 5 hours, and I confuse everybody more than when they got there. We like to go in front of groups that we're invited to and answer the person's questions that they have burning. Answer burning questions. Why? Because I then know that a person walked out of that room and they understood their specific situation. And also, there's always someone else in the room who has a similar concern or situation. So we like to engage in those. We also go to many community events that we can participate in and support, just to allow people informally to approach us and walk up to us, get our business literature, get our cards, our information, and reach out to them. They reach out to us.
Okay, that's a good way. Well, we definitely want to thank you guys for participating in our Health and Fun Fair at the Eastern Market, because that's what we do. So we hope to see you in the years to come. So this way, we actually have a chance to get to know each and every service out there. Our commitment to the community is to educate and provide resources to businesses like yours, so people will know that there's something that exists in the services that they need. A lot of people get confused. Okay, and today you have clarified some situations for people to understand what the open enrollment period really means, the quarter that it's in, the redetermination period, and how did all this stuff come about, because people don't know. But I did have one question about Social Security. Now, we do know that upon your 65th birthday, you said, apply for it 4 months in advance, but there's also a situation where a person may have a disability or so and receive SSDI. So you become Medicare eligible based on the disability.
Yes, so Medicare is available to 2 communities. The persons that turn 65, that is their eligibility. They turn 65. Medicare is also available to persons who are under 65 and they have either disabilities or medical conditions. For example, end-stage renal disease or kidney failure. ESRD is what you hear referenced. If you have ESRD, you are eligible for Medicare irrespective of what your age might be. Yeah.
Correct. So people need to know, because some people say, hey, well, I didn't get that coverage, but you are eligible under the guidelines of SSDI, Social Security Disability Insurance, and then regular Social Security, Medicare.
Yes, correct. Okay. Yes.
Okay.
Yep. Okay. So there are 2 access points, either becoming 65 years old or because you have been approved through the Social Security Administration to receive Social Security disability income because you have a qualifying disability, according to the Social Security Administration. That is called SSDI, and that is a pathway to Medicare irrespective of your age.
You put that very well right there. I know that someone's...
But did it make sense?
Yes, it did. Yes, it did. Because somebody's like, oh, I didn't know that part. Okay, so, and that's, you know, a great way to clarify that for people, because, you know, it's a lot of confusion in there. When do I apply for something? When do I don't? Oh, did I miss the open enrollment period? Oh, no, I didn't. Oh, I have opportunity to upgrade or change what my program is from this period to that period. A lot of people don't know, and we've got so many different types of insurances on the table now that I have what I have, but I don't like them. I got to wait a whole year to get rid of them. That's what people are saying. So now we know that there's a period for change.
There is.
Okay.
There is. Now, and it's not just one period, because Medicare actually makes available what they call special enrollment periods. Now, those are for special circumstances. For example, Medicare plans are all set up by county. That's why we always ask, what's your zip code, so we find out what county you live in. Every Medicare plan is not available in every county. So if a person lives in Oakland County, and let's say that they move to Macomb County, their plan they have in Oakland County may not be offered in Macomb County. If that's the case, that person becomes eligible for a special enrollment period because they moved. They moved from one county to another and their plan is not available. Or they can move from one state to another.
Oh, yeah.
And that is, again, a relocation, a move.
So how do they go about checking before they make those moves? Or do they check?
Should they check? They absolutely should. Now, often what happens is this. Many people, if they're receiving Social Security, they make the change without even realizing it because they don't want their check to get messed up.
Right.
So they'll call Social Security and let them know, my new address is. So that's how Medicare many times finds out that, you know, Rodney done blew the coop. Rodney don't live in Tuscaloosa no more. He's now up there in Michigan. And they find that out because I didn't want my check to get messed up. So I told Social Security, and they updated my file, which Medicare then found out about.
Okay. Well, you know, Rodney Ross, I hate to have come to an end because I know somebody's saying, oh, some more. So, as I usually say, can you come back and join us again?
I'd be happy to.
All right.
I make one thing.
Sure.
Our reach is Port Huron, right here in the Tri-County area, Lansing, Kalamazoo, as well as in 4 other states. So we can help.
All right. Thank you so much. And please tell John Becker we said hello.
Will do.
Okay. All right. Well, ladies and gentlemen, you know, I had to have Rodney Ross come back and tell us some more good information about the Medicare Advantage program so that you would understand how to decide which one is the best thing for you. If you're still not sure, give us a call, 1-800-323-5336. And always know that you can reach out to me and I will respond back. I'm your host, Marsha Florence for Just Ask. And what do I always say? If you have a question about a person with a disability or if you just have a general question, don't be afraid to ask. Just ask. I'm your host.